Dr. Amber Klimczak.
And we are
Two Peaks in a Pod.
Well, welcome back, everybody. Dr. K, I wanted to run some celebrity stories by you.
Oh, boy.
Okay, so I was looking the other day, and did you know multiple celebrities, including Celine Dion and Mariah Carey, are claiming that their IVF specifically became successful because of acupuncture?
I believe it.
Okay. So I
I'm a
thought maybe
believer.
today let's talk about acupuncture in terms of its use for fertility treatment, and let's talk about whether we recommend it for our patients. And I also thought maybe we could share with our patients some of the things that we're thinking about adding to our practice too.
Yeah, definitely. So Celine Dion and Mariah Carey used it when they were going through fertility treatment, kind of as an adjunct, right?
Yes.
Okay.
Yep.
So.
And so they both did IVF, and I think they even both had twins, from what I understand. So it's like, wow, it must have really worked too well. Yeah.
Okay.
Yep.
Yeah. So I bet a lot of our listeners out there, if you're going through fertility treatment or struggling with fertility, have heard about acupuncture for fertility. It's fairly common. I think that people have been introduced to it by friends or even their providers, right?
Yeah. Oh, yeah, absolutely. Now, I've never had acupuncture before, so I guess it's good to even talk about what is acupuncture.
Yeah. So I have done acupuncture. I actually did it when I was trying to get pregnant with our second, and I'm actually doing acupuncture now, and I really enjoy it. So traditional acupuncture is where they actually take small needles, they, push them in, and they're not going deep. I'm a needle phobe. Everyone knows this about
I know. I was
us.
about to say,
Yeah.
I am shocked right now because you have been telling me the whole time I've known you, you are terrified of needles. So are you telling me you willingly signed up to let somebody stick needles in you?
The first time I did it, so obviously this must have been almost 4 years ago. The first time I did it, my heart was beating through my chest. Like I was like, I have no idea what to expect, And they really don't prep you that much because it's just they do this like 20 times a day. It's not no big deal to them. And they, at least the experience that I have had when they're inserting them, there's like kind of like a flick next to it. I don't know if it distracts the nerve or something. And so it's very superficial. It's not enough to penetrate that you're going to bleed or really be stuck with a needle. And it gets to these acupressure points, and they stimulate these certain points all over your body. Sometimes it's your ears, your head, your shins, belly, a lot for fertility stuff.
So when you say they flick, like they take their finger and they kind of flick right next.
It feels like it. I have my eyes closed when I'm doing it.
Yeah.
Obviously. And one of them that I've been to was almost like a little device that they're using to do it. I think it has like a cup around it. Y'all should Google this so you can see the picture, but it's almost like a clear cup and there's a needle in the center of it. So that cup applies the perfect amount of pressure and then the needle is kind of deployed. And then, you feel like this little flick kind of next to it. And that's really all I felt. I have never felt a sharp pinprick ever. Okay. And I would say if you are, that might not be right.
Well, maybe if you would share with our listeners, maybe you can take a little video one time of like you getting it done so we can just see what it looks like so we can visualize it a little bit better. But do you ever bleed from it?
I've never bled. I have heard of people bleeding before, and it probably has to do with I actually take aspirin, so I think that I would be more prone to bleed. But I've never had any spots really that are bleeding afterwards. So it doesn't seem like it's deep enough really to make you bleed. And you can see a little imprint at some of them where it was sitting, and it's almost like not a full puncture.
Okay. And so they stick all these needles in you and then you're just laying there, right?
Yes.
How long do you have to lay there?
30 minutes
that's a long time.
Yeah. So when I read the studies about it for traditional acupuncture to be efficacious, my understanding is 30 minutes is the amount of time that a lot of people use in the studies. I'm not sure how much benefit you get with doing it longer versus shorter than that, but that seems to be the number that a lot of people use, which I agree it's a long time.
Yeah. I feel like I would lay there and I'd be like, I have to go to the bathroom now. Like, what do I do? Like that's
Well, this really magical thing happens to you once the needles are in.
Okay, what happens?
You start to feel kind of like this tingling energy kind of running through your body. I'm not kidding. And like I'm a scientist.
No,
like this is like
I believe you.
So you feel I think it's because they know what they're doing, right?
Yeah.
They hit certain pressure points,
Mm-hmm.
and I really feel like this sensation going through, and it's very relaxing. I mean, a lot of the reason why I'm doing it is stress relief. You know, we're just like little balls of stress.
Yeah.
I decided I can't live like this anymore.
Yes, that's right. That's right.
Yeah.
Okay. And then how many times a week would somebody usually get acupuncture, just on average?
Yeah. So a lot of the acupuncture clinics will bundle. And so they'll give you a price for 12 sessions or something like that. I would say what I've seen mostly is once a week, which is a time commitment, right?
Yeah.
You have to drive to the clinic and take time away from your schedule and go there and then have the actual treatment, which altogether takes about 45 minutes, right? By the time you get in there and do it. So it certainly is time consuming. And I think you can talk with your provider about whether they would recommend doing it less frequently than that or more frequently. But a lot of people who are doing it for chronic conditions will go on a regular basis.
Okay. And then whenever they put the needles in, are they using the same spots every single time, or is it different? And from patient to patient, do you think they're using different points?
So when I have had my consultations in the past, a lot of times it's for fertility, and it's sort of interesting. They have their own version of what we fertility doctors call the HPO axis, and that's your brain talking to your ovaries, right? And they have different kind of body parts for it, and based on what your ailment is, for example, fertility, then they have certain meridians or lines that run through these systems that they're going to hit with the pressure points. And so it does seem to be tailored to whatever you're trying to treat. And of course, everyone knows I struggle with fertility a lot, so I always get the same points hit.
Gotcha.
But I think if you have something else going on, I also struggle with sleep, so I think they have certain ones that are helpful for like stress reduction and putting your mind more at ease from stress. So yeah, it does seem like they're trained to know which points go with which ailments, is my understanding.
Okay. And sorry, I'm asking you all these questions as if you're an acupuncturist.
I'm not a specialist.
And honestly, it might be nice. Maybe you can ask your acupuncture person if they want to come be on our podcast so we can get more interest too. But I'm sure when you signed up for this, they probably had you sign some kind of consent form. Is there any risk to doing acupuncture? Could it cause any problems? Or
I do remember that bleeding is one of the things that is listed there. I'm trying to remember.
Probably think maybe infection if somebody was immunocompromised or something, right? You're sticking needles in, maybe. But
I can't really think of anything. I mean, no one really reads consents like that. I'm a bad example. I just signed my life away. I don't know. Maybe it kills me.
True.
But
I had a patient recently who she didn't like one of the sentences we had in our consent form, and I was like, "Oh, you read that whole thing?" I'm so impressed. Whenever I go to the doctor, I just sign my life away. I'm like, yep, I might die. Okay, great. All right, next page. Like,
exactly.
You just sign.
Yeah. I don't know. So to me, I think the risk with traditional acupuncture are exactly like you're expecting. Pain at insertion site, I'm sure there is a chance of light bleeding, right? Discomfort. But I don't think that there's really a lot of big risk to it.
Yeah. Well, I get a lot of questions about acupuncture in general. And usually, of course, the biggest question people ask is, does this actually help my chances of getting pregnant? And I've looked at so many studies throughout the years, and I'm sure you have too. And I think the biggest problem is you see conflicting results of the studies. I've seen some studies that show it helps, and then some studies show that it doesn't. And usually I say, hey, I'm okay with something as long as it doesn't cause any harm. But indeed, I have even seen a study showing acupuncture lower chances for success. And when I really put all of the studies together, what I really kind of came upon is that acupuncture seems to be most helpful if you find it as a stress reliever. If you're lowering all those stress hormones in your body, then that is going to help your fertility. But in some women who have a needle phobia, like you said, your stress hormones might go higher during and after acupuncture, right? Or if you are really stressed because you don't even know how you're going to work it into your schedule, or if the financial part is really stressing you out because you don't know how you're going to pay for it. If all those things are creating a lot of stress for you, then acupuncture can actually work against you as well. And so my recommendation is usually, hey, if you're feeling stressed and you feel like this really works for you, go for it. If you feel like the thought of it is stressing you out, I don't think you need it. Is that kind of similar to what you talk to your patients about
Yes, yes. So I agree. I think there's a lot of heterogeneity out there in the data that we know about acupuncture, and your explanations are exactly right, right? It depends on the patient and whether they find it relaxing. And I agree, like we already throw a lot of stuff at you as fertility physicians. And then if we say, also, you have to drive to this other clinic one time a week and you're going to fit in an hour break in your schedule to do this. That's a lot. You know, a lot of our patients are very busy and already have a lot of time commitment. So I think it can be really stressful, but other patients really find it as a reprieve. They schedule me time, you know, it's time away. You get to sit still and no one can talk to you. So
we're not trying to call you. I'm probably texting you. Dr. K, what about this?
Yeah. So, yeah, I think it depends on the patient for sure. But, you know, I think we're going to discuss this more, but there definitely have been some good studies for acupuncture.
Are you allowed to have your phone in there? Can you text or no? I guess that's probably hard if you.
The place that I used to go in the Northeast was much smaller, and all my stuff was like kind of close to me. I've never moved with them in me because again, I'm paranoid. I'm sure you could.
Probably not a good idea.
But the one that I'm doing here, they give me a little button if you need anything, you can press it. So they can come rescue you.
Because I do feel like I would go crazy if I had to lay there for 30 minutes without my phone.
I think it's very therapeutic.
It's probably good.
In this day and age that we live in, I think we should not look at our phone for 30 minutes.
You're right. Okay, well, I wanted to share just a few anecdotal stories about acupuncture. So I've had maybe about 2 or 3 cases happen over, let's say 5-7 years or so, where I've had a patient and we did IVF, and unfortunately IVF did not work. And in those circumstances, sometimes we suspected or thought there might be egg quality issues. And while we were trying to work on egg quality, which would include a lot of things, trying to make sure they're getting better sleep, working on diet, nutrition, taking fertility supplements and everything. But as part of that, sometimes we would do acupuncture. Well, when I say we, I don't do it. I send them to somebody I recommend. And all of a sudden, they're pregnant naturally on their own without IVF, which then, of course, I get jealous. Of course, I'm so happy for the patient, but then I'm also jealous because I'm like, hey, I did IVF on this person and it didn't work, yet you could do acupuncture and it worked. And of course, maybe it's just a coincidence that it happened, but I'm always kind of fascinated by that. And I do kind of take that as a moment too to tell patients if they did have an IVF cycle work, look, it doesn't mean it's hopeless. It can still happen, right? Mm-hmm. Have you ever seen that happen before?
Absolutely. Okay. I truly, I think acupuncture helped me conceive my second child for sure. And I attribute a lot of that success to it. But again, I think it has a lot to do with stress reduction, and IVF can be really stressful, right? We know that IVF can work for patients, but I think it does help to combat a lot of the stress that we put on our patients, right? It's all about balance. And I actually think this is a lot about what peak fertility is. We really focus on how can we make your life easier going through fertility treatment. Yes. And I think if acupuncture is one of those things, we're going to support you with that.
100%. Yeah. I think we both really favor the more natural side of things. We're both a little more crunchy, crunchy plus science maybe together, but yeah. Okay. But then I do want to complain a little bit about acupuncture. So my only complaint is that when I send my patients to some of the acupuncture specialists, which I love and I have been impressed by, sometimes they're trying to add on some extras besides just acupuncture. So acupuncture, you've got me sold. I'm like, yes, let's do it. But then sometimes they're trying to tell you need all these other special supplements that only they sell that you can't get from anywhere else. And number one, I don't like that. I feel like there's a conflict of interest when you're trying to directly sell somebody, something that you say that they need that only you make.
Right.
And two, I honestly have some serious concerns about what these supplements contain. So I am curious, when you went to get acupuncture, did they tell you needed any supplements?
No, but I think, they're probably weary of selling me.
Do they know you're a fertility doctor?
Yeah. So, I don't have time ever to change out of stuff, so they know what I'm doing. So they probably, wouldn't do that. But I agree, I would say I'm actually very, very wary of
Yeah.
supplements.
Mhm.
And, my patients know this, and we go through their supplement list,
Mhm.
and supplements are not regulated. We don't really know what's in them. So I would definitely advise against that. The other thing that my patients sometimes experience when they go see an acupuncturist is they give them a lot of lifestyle recommendations that they feel like are unobtainable. And I think that that can be really challenging. Some of the things my patients have told me is they were told they could never drink any type of cold fluids.
Oh.
So they can't
Mhm.
have ice in their beverages. They need to be drinking warm, lukewarm beverages all the time. And I think the idea is like it's cold going near the uterus, and it needs to be warm. And they needed to have socks on their feet at all times, so warm
Okay.
socks, because they didn't want them like their body using extra energy to heat them. And I mean, it's Texas. People want to drink cold water and not wear socks on their feet,
Yes,
And I really have and recently I've had a lot of patients complain to me about that. And they're like, do you think there's anything behind this? Because I'm killing myself trying to keep socks on, And I agree. Like, right. Again, it goes to that point of, is this stressing you out? Right. Or is this going to be beneficial to you? So you kind of have to take it for what it is, I think.
Yeah. Well, and I would think too, I mean, let's even just point out, okay, stomach is way up here, uterus is way down here. And really too, if you even think about it, if you've ever thrown up, the throw up comes out body temperature, so your body heats it up pretty quickly. So I'd say cold beverages are fine, right?
Yeah, I think cold beverages are fine. The data that I'm aware about in terms of cold beverages is yes, does your body expend energy to heat fluid as it comes into your body? The answer is yes, actually. There's been studies that drinking really cold fluids a lot throughout the day actually can promote weight loss because you're using more energy.
See,
Yeah,
that's why I drink my Diet Coke every day from Chick-fil-A.
Yeah, exactly. So I think, are you expending more energy than when you're drinking warm liquids? Yeah, absolutely. And if the idea is you need to retain more energy to procreate, no, I think it's a bit of a stretch. I've never seen any, high level evidence.
Well, what I want patients to know is, and I will say too, look, some supplements we love. Like I think we both love coenzyme Q10, we love folic acid. There's a lot of supplements we love, but the ones that concern me are ones that are sometimes marketed as cortisol support or adrenal support or thyroid support and everything. Because when you look to see what is in those, I mean, y'all might be shocked to hear this. Really, they take an animal, such as a pig, and they grind up the adrenal glands and the thyroid gland, and that's your supplement. So you're literally putting ground up animal organs in your body to try to fix an issue. And I mean, number one, I hear that already, and I'm like, nope, I don't like it, right? But number two, in fact, I have a patient right now. I just checked her blood test, and everything is totally wacky in her body right now. And I think it's probably because she's taking this supplement. So we're going to stop it and see if it all gets better. But I'm like, look, guys, I mean, and who knows? You probably feel great if you're essentially swallowing adrenal glands. Okay, you probably feel great, but that is not good for you. You should not be doing that, right?
Totally. Yeah. Yes. I mean, we've talked about supplements before. You just have to be careful. It is a phenomenon out there, right? We're all advertised all of these different supplements that potentially can help whatever ailment we're dealing with. You just have to be careful because these people don't always have your best interest in mind. They really want some money from you, and you might be desperate, so you're willing to pay for them. So
and I mean, sometimes it's hard too because they'll send me a list of like 30 things, and it's like root berry, this and that. And I'm like, I've never heard of this before. And I just say, look, I don't know. I haven't heard of it. But if I don't know about it, I probably wouldn't take it. Because could it help? Maybe. But could it harm? Maybe. And so let's just not do anything risky. Let's stick with things that we know that are proven to be safe.
Absolutely.
And I will say too, in some of my patients who have chosen to do these supplements, a lot of them will tell me they end up with ovarian cyst and or irregular cycles and things like that. So I really think you can just politely decline any of the cortisol thyroid supplements or anything like that. If you're seeing us, we will have already checked your thyroid. You should be in good shape as far as that goes, and we can recheck it if you need to. But really kind of just stick more with the acupuncture, right?
Yeah.
Okay, good. So, because we've talked about acupuncture over the years, one of the things we had thought about to try to help our patients is should we offer acupuncture here? And when we looked into it, it's actually just a big undertaking. There's acupuncture school that you have to go to become a licensed acupuncturist and everything. And then we even thought about, should we hire an acupuncturist to come in and offer services? But that's been hard to find somebody. But you recently shared with me what you did at your last clinic. And so I wanted you to kind of share your experiences with an alternative to acupuncture.
Yeah. So there can be traditional acupuncture, like what we're talking about with needles, but then I would say an alternative to that is laser acupuncture therapy. And I think it's becoming more common because there's a lot of advantages to it. And this is actually what we did at the last practice that I was at, and patients really loved it. And it's really interesting. So the way this works is it's LLLT, so low level laser therapy. And this is a cold laser, and it's the same concept. It penetrates the depth the same amount that a needle will. Sometimes people call this needleless acupuncture, and it stimulates those acupressure points in a very similar way. But there's a lot of more, I would say, just approaches there's a lot more advantages to it that make it more practical, maybe is what I would say. So it's a lot quicker, right? So it takes maybe 5 minutes even to do it.
Great.
So you
instead of 30 minutes,
and so having to lay there, and maybe
great.
for people like Dr. Reed who can't sit still
for 30 minutes. Check my TikTok.
Yeah, exactly. So you can have the benefits much quicker. It's needleless, so it does have that advantage to patients that actually maybe you do have a true phobia and it's anxiety provoking for you to even see needles. Like I said, from my experience, it doesn't hurt, but there are people that are like, I could never do acupuncture because there's needles. So it really allows you to have those benefits without being inserted with needles. It's a lot more mobile, right? So we can have it here at our clinic. We don't have to make you drive across town to a different center to have it done. So it makes it a lot more accessible to patients, and we can really possibly integrate it into the routine that we already have for them.
Yeah, well, it sounds really awesome. When you were telling me about it, I definitely wanted to know more. And one thing that, of course, was really important to me, as I know is important to you, is if we purchase this very expensive piece of equipment, by the way, I'm telling you, Dr. K has expensive taste, okay? But if we were to purchase this expensive piece of equipment, what is the benefit to our patients? Will it increase their chances of getting pregnant when we do an embryo transfer? And so, of course, I went ahead and researched this and did a literature review. And there's only about 3 studies that I could find, but I did think it was really interesting. And so I thought we could kind of talk through each one of the studies. The first study that I saw was on patients who did an embryo transfer. And I think they did the protocol you're used to, right? Where they did it before and after the transfer. Is that right?
Yes.
So like all on the same day. They did it twice?
Exactly. Yep. You lay there, you get ready for your transfer, they administer it, then you have your transfer, you lay there afterwards and they administer it.
Okay, great. And the study did actually show a higher pregnancy rate when compared to the other treatment groups. And I was pretty impressed by the study too, because they compared it to traditional acupuncture and they compared it to a group that did no treatment at all. And then they even did a laser sham group, which I really thought was great, because that was essentially making the doctor and the patient think they got the laser, but then you don't really know if they got it or not until it was unblinded for the study results. And the laser acupuncture group did have the highest pregnancy rate, which I thought was great.
Yeah, I actually agree with that control of the sham acupuncture, the laser acupuncture, because that's actually my concerns and my beef with a lot of the traditional acupuncture studies, because I think it's very difficult to have a true randomized controlled trial for acupuncture, because if you're getting acupuncture, it's very hard to do a sham, especially if anyone has ever experienced acupuncture. You're going to know that you're not really getting it. But laser, right, it doesn't hurt. You could definitely do a sham. And so I do think that was a nice control and very encouraging data.
Yeah. So I thought that was really interesting. And I will say too, I mean, I think that's what we know from studies on anything, that, oftentimes they use a placebo. So if it's a pill you're taking, half the people may take the pill with the active ingredient, the other half may take just a sugar pill. And then you look to see You look to compare the results. And what we know is even when people take a sugar pill, they oftentimes will have better results because the power of the mind is amazing, really. If you believe it's going to work, you actually do have higher chances of it working. So, I mean, I think that's an important component to address, and I love that they included that. That was a very thorough study. So they have higher pregnancy rates. So I felt like that was really encouraging. But then importantly, whenever we look at a treatment study, we need to look at the live birth rates. And the live birth rates were really pretty similar all along the way. But I was saying sometimes you see that when there's just not enough people in the study to really discern that. So I don't know. I was kind of thinking, is it just that it was too small of a study to really be powerful enough to see the difference? Or is there truly just not much of a difference? Do you have any thoughts on that?
I feel like a lot of the studies out there, this is a really common finding in fertility studies, right? Just so that you guys know this whenever we're talking about data. Many studies will observe a difference in pregnancy rates, but then ultimately not live birth rates. And so we see this diminishing effect. And that's one of the questions. Do we need a larger sample size? Do we need to be studying more patients? Or what's considered clinically significant? A lot of times we're looking for really big differences between the two groups. So yes, I agree. I think that having increased pregnancy rates are encouraging, right? You have a chance, you're in the game, you have a pregnancy. Right. So, and then you have to look at loss rates after that, really. But I am very encouraged by the data.
Yeah. And then, but the next thing I looked at is I said, okay, well, it helps, but how much does it help? So I was trying to compare, for example, the laser acupuncture to the no treatment group. And I really only saw about a 3% difference in that study. And they said it was statistically significant. So great, it passed the stats. But really, I had to ask myself, is that clinically significant? Is a 3% difference enough to ask a patient to do additional treatment, to essentially pay, more for laser acupuncture? And for that, I was kind of like, I don't know if I would sign up for it if it were me, but I honestly think we could always leave it up to the patient and see. There may be other people who say, if it's 1% higher, I want to do it. I think it's a very personal thing, right?
Yeah. And I think it depends on the patient and who you're counseling. I've been on the other side of things as a desperate fertility patient myself, right? And I do think that for some people, if you tell them, hey, if this is the chance between it being, 60% or 63%, I think that can be meaningful to the patient. So it really depends on who you're talking to.
Yeah. So after I got done with that study, I was kind of like, well, I don't know if I'm sold on it. But then I saw a couple of other studies that I thought were interesting. So one was on patients who were going through the IVF process. So the first one was just looking at people who did their embryo transfer. This next one looked at patients who did IVF, and they did notice that for patients doing it throughout their IVF cycle, they had much lower stress levels from the acupuncture. And that seemed very significant. And so I did really like seeing that aspect of it. Even if it doesn't change very much the overall pregnancy rate, if you're changing the patient's overall experience and just helping them feel more at peace and more calm and really just safer, then I think that is definitely something that is impactful.
Yeah, and I think that can't be underestimated in terms of a barrier to treatment.
Yes,
I often have patients that see me and they say, I'm here for fertility treatment, but I can never do IVF. I mean, they sit down across from me at the desk and I'm like, well, why do you feel that way? Well, my sister went through IVF. My best friend went through IVF. I saw what she went through, and I know I could never do that, right? So there's this huge barrier to care for some patients where they just feel like the stress level that would be on them going through IVF is too much to bear. So anything that we can really do to lower that, I think ultimately increases success rates, right? We know IVF often has the highest success rate of any treatment we can offer. And if we can help you to get through it, that's pretty encouraging. So
yeah, that's a really good point. Okay, and so then the third study I saw was very interesting. So it looked at men who had low sperm counts, and they did a series of laser acupuncture, and it increased their sperm counts and increased the motility of the sperm too. And I was really shocked to see this one because I've never heard of this before. I thought that was really interesting. And I know that some of our male patients are so proactive. If they have an abnormal semen analysis, that's a common question we're getting. How can I make it better? How can I, and a lot of times, again, we're recommending lifestyle modification and supplements and seeing a urologist and everything. But gosh, it would be really nice to have, again, a more natural way of letting them potentially make some improvement on their sperm count.
This was news to me. I haven't seen this study because I just haven't looked for that treatment facet really. And yes, I agree. I have a lot of partners that, they feel like they're struggling when they get this information. They want to do everything they possibly can to improve their sperm. And so that it is a nice thing to be able to offer them something else.
Yeah, absolutely. So I thought that was great. Now, of course, I was trying to process this too, because I'm like, okay, so where do you do the laser acupuncture for the guys? Like, I mean, honestly, I was like, do you have to laser the testicles? Like, how's this going to work here, right? So, but I looked it up in the study, and no, they have specified points, just like for acupuncture, if you're treating for certain conditions, they have certain points on the body that you want to do it. So they have the same thing for the guys. So I just don't want to scare any of the guys. If we ever have this as an option, we will not laser the testicles or anywhere near there. These are points all throughout the body.
We might have some men signing up for that.
And then, so I saw those 3 studies. I didn't really see many other studies. And so I had a lot of questions going on in my mind. Like, what, could laser acupuncture help somebody going through an IUI cycle? You know how we're very into that concept of a spa IUI. We're trying to help our patients feel very relaxed during their insemination. Maybe that could be a good option to add on for them. Or even just if they're trying naturally, or if they're doing, just ovulation induction with time and intercourse, could laser acupuncture help in those cases? And there's just no data there. And so I'm thinking we're trying to decide if we're going to add laser acupuncture to our practice, but if so, maybe we need to do some studies.
Right. Yeah. I definitely think this is what's missing, because this is what I've experienced, throughout my journey, is that it's something that I feel like we need to be consistent with. It's an add-on maybe throughout your whole treatment cycle, because the randomized control trials that look at embryo transfers, it was just 2 times they got this right before and after, and it made a difference. But how much of a difference could we make if we start from the beginning of a cycle, or maybe you try a few cycles in a row? I think it could really have accumulation of effect. And so, we only have anecdotal stories like myself, but I would love to be able to get some of that data, right? And it's something that we could potentially research.
Yeah. And then also, if anything, we could just laser acupuncture each other.
Oh, I know. I think I could single-handedly support the laser.
I mean, you and I are both major stress balls. Could you imagine how in our new life, we might just be relaxed all the time?
I'm here for it. Yeah.
So we want to hear from you guys. Please give us some feedback. Should we get laser acupuncture? Yes or no? Is this something you would be interested in? Do you want it? Do we have the patient demand for it? Or does it seem like, not really interested? Or do you guys want us to try to work harder to get actual acupuncture in the clinic? We definitely want to hear from you guys and see what y'all's thoughts are too. And then I guess, should we wrap it up for the week?
Yeah. Okay, thanks for listening.
Thank you guys, everybody. If you would be so kind to leave us a review on the podcast, or for our practice, or for our individual physician sites, we would be so appreciative to you guys. And we hope you have a great day.